Hi, my name is Margaret Ingalls. Today's date is 5/18/21, and this is my video regarding surface anatomy. So I'm going to first start to talk about more of the concept that utilizes surface anatomy. So as an athletic trainer, I perform dry needling on patients. So in order to do that, surface anatomy is a huge necessary thing to know, to be aware of, and to utilize while you are performing dry needling. Especially, I'm trained in the first level, so we don't do anything near the lung field or really in the abdominal area much. Especially with the lungs, you have to be super careful, obviously, that you don't puncture the lung with the dry needle. So surface anatomy is super important when performing any dry needling in this upper back region or on the front of the chest too. So what I'm going to specifically talk about and point out are structures that I need to make sure that I am aware of when I'm dry needling on the posterior side of the shoulder and the back. So first of all, we just need to be aware of where the spinous processes are in the middle of the back. We do a lot of dry needling in the posterior shoulder for the rotator cuff. So we really need to be aware of where the scapula is. So what I try to find first is the inferior angle of the scapula. And there's a few points where we can needle directly. So the dorsal scapular homeostatic point is right on the back of the scapula. And so what we can do is we can kind of take our thumb and our index finger and kind of wedge that right up in that inferior angle of the scapula, and then move our index finger to the middle, and that's exactly where I know to put my needle, and I know that there is a hard bony back to where I'm putting that needle. So you have to be aware of where the inferior angle is, the medial border, and the lateral border of the scapula. Next, I do a lot of dry needling up in the supraspinatus region. So there is some trigger points specific to the supraspinatus that you use the spine of the scapula, so this top angle of the scapula, and then you also need to be able to know where the acromion is and where that spine of the scapula and the acromion meet. So I take half the distance between there, and then I'm angling that needle straight down into that supraspinatus fossa. And then we also do some dry needling on this. There's a few homeostatic points. The suprascapular point, we also have to know where that medial border and the spine come together, and then I'm angling a needle in mostly almost like parallel with the skin, just so we know that we're not getting near the lung field. We're needling towards a bony structure, so more of that where that medial angle and the spine of the scapula meet. So always looking for a bony border when dry needling in the back. We also do a few other points in the shoulder, so going into the glenohumeral joint. So then again, I'm palpating for that acromion process. I'm finding that supraspinatus tendon, and then I'm inserting that needle in there. So all of these points that I'm talking about regarding surface anatomy have to deal with the musculoskeletal system, but then we're also being aware of where the organs are in relation to in relation to these musculoskeletal aspects. And that is my video on surface anatomy. Thank you.